Let's talk about vaccines. First up, unless you're vulnerable, elderly or ill, or unless you're living in Melbourne's northwest, you know that coronavirus is not really circulating anywhere near you, and your chances of getting seriously ill from the virus are so low that the incentive to get vaccinated is not really strong, is it? I mean, a minute chance of getting sick from coronavirus versus a minute chance of getting sick from the vaccine. It ends up being a bit of a stalemate for many people, doesn't it? The thing that will hurry us up is an outbreak. Whenever there's outbreaks around, whenever people know the virus is around, they're going to be much more motivated to get the vaccine. If the virus is around, people will hurry to get vaccinated. It's quite simple. It's what we've seen overseas. But also, if people could choose their vaccine, they might line up more readily too. For instance, if you're over 50, you're not allowed to get the Pfizer vaccine. You have to have the AstraZeneca vaccine, the one that has had the blood clotting issues. Minute that they are by number, it's had those issues. But the Premier of Queensland, Annastacia Palaszczuk, has tweeted this morning that she's had her Pfizer jab, even though she's over 50, and she's done it so that she's ready to go to the Olympic Games in Tokyo in case she needs to lobby for her state. I mean, how about that? She gets to choose Pfizer because it's quicker and easier in case she gets to go to Tokyo. Now, she'd been criticised earlier for not getting the vaccine as soon as possible. She's the last Premier to get the jab, and she was forced to explain all this today.
I had an accidental dog bite, so I had to go and have my tetanus. And they ask you if you have your tetanus, you need 2 weeks from when you have your tetanus to have a COVID. Then I had my flu vaccine. I have done everything I can physically be required to do.
The dog bit my leg, excuse for homework, hey? Really, it isn't that funny, is it? Because remember when they all said we were all in this together? How many more over 50s would grab a vaccine if they had the Pfizer option? I wonder. And how many more would get vaccinated if the federal government allowed us to travel overseas after getting vaccinated? One rule for some, another rule for others, it seems. Personally, I'd be happy being subjected to the Annastacia Palaszczuk rules.